Hi everyone, happy Friday. My name is Alli and I'm here with one of our Florida Orthopedic Institute shoulder and elbow specialists, Dr. Mighell. How are you tonight, Dr. Mighell?
I'm doing great. Thank you so much. It's great to be out here. We're out here at Gaither High School, and this is going to be one of the rivalries between Gaither and Plant High School, and we're here to talk a little bit about sports injuries tonight.
Yes, we sure are. And Dr. Mighell is the official team physician for Plant High School. And so we're wishing the best of luck to all of our student athletes tonight, wishing them a safe and successful game, and good luck to all of our teams this evening.
Okay.
So first up for our Friday night topic, we're going to talk about separation and instability. So first up, what is shoulder separation and instability, and what do these influence each other? Can you tell us about that?
So this is a really good question that I think a lot of people don't really understand. So they're completely different problems. So when we talk about a shoulder separation, that's where your shoulder blade gets impacted down, oftentimes from a vicious tackle, a return, and it separates the shoulder blade from the collarbone. This injury, while it is pretty dramatic and painful, allows the athlete in most cases to make a recovery, and usually we can return them to the field within 4 to 6 weeks, unless it's a very severe one that we call a type 4 or 5. Those are the rare ones that sometimes require surgery. But in general, for the athlete, this will allow them to return to play. Shoulder dislocations are very different. So you asked me about those, and a shoulder dislocation was the ball actually comes completely out of the socket. And when the ball comes out of the socket, it's usually another very dramatic injury, and the arm can go numb, and the athlete is usually on the field in a lot of distress. So when the team comes out, the athletic trainer, the coach, myself, to evaluate the athlete, if we're lucky, sometimes we're able to reduce or put the ball back into the socket actually on the field. But if you wait too long with the spasm that occurs, it becomes very difficult, and then you have to take the athlete to the emergency room where they're given medications that will relax their muscles, make them more comfortable, allow them to actually have the provider in the emergency room reduce the shoulder. Once you have a shoulder dislocation, though, oftentimes it's very difficult to return to play, and so for a lot of the athletes, this can be a season-ending injury for them. So that's really tough, and a lot of times these kids only have 1 or 2 seasons that they can play high school football. So if they do get one of these dislocations, it can tear the lining off of the socket. And when that happens, it can actually require a surgery where we go in arthroscopically. So we use a small fiber optic camera. We go in the shoulder and we see this, and we put little anchors, which are tiny little screws that are made of plastic, into the shoulder.
So talking about that, can you mention and shed some light on what is kind of the care process, and how do we get these student athletes back on the field?
So it's a very, we have a protocol. So once the athlete has the dislocation, they usually come back to the office and they're in a sling. The sling will be worn for a period of 2 to 3 weeks to allow the soft tissues to recover. And then we have to make determination whether we want to try a very aggressive therapy program to rehab the shoulder to allow them to return to play versus surgery. Oftentimes we get a special study called an MRI scan, and the MRI scan will allow us to better visualize the actual injury itself and can guide us in treatment as to whether this is a surgical case or a non-surgical case.
Okay, makes sense. So then finally, if a student athlete is injured with a shoulder separation, can they get back on the field and play at the same level, competitive level that they were playing at before the injury?
Actually, this is an injury that if you can fix it and you wait, and the waiting period after surgery is about 9 months.
Okay.
So that'll kind of eliminate them from that season of play, but they can get back to the same level of play if they have the surgery.
Okay. All right, well, thank you guys for tuning in, and thank you, Dr. Mighell, for talking about this with us. And again, good luck to our student athletes. We hope everyone has a great weekend, and stay safe this weekend. Thank you, guys.
Thank you, and I appreciate you interviewing me, and congratulations to Plant High School. Hopefully this is a great year. It's always great to be out with the kids on a Friday night.
Thank you.